And next question is coming from Malaysia. Randy. Randy, can you hear us? You would need to unmute yourself.
Oh, sorry. Yeah, I can hear you now. Yeah.
Yes.
Thank you for taking my question. I'm Randy from the Telegraph. My question goes to the WHO in Geneva. So I'd like to ask you a question with regard to the spread of the virus in prisons and mental health institutions in Indonesia, the Philippines, and basically the rest of Southeast Asia. So how worrying is this situation in the region in general, do you think? And what do governments in the region have to do more to tackle this crisis that might be taking place in those facilities? Thank you.
Thanks for the question. I don't have specific numbers on the impact in prisons or mental health institutions in countries in Southeast Asia, but it's something we've issued guidance on in both cases. It's a concern. We've said the same about long-term care facilities in Europe, dormitories for migrants in many countries in the Middle East, in South Africa, in Singapore, prisons all over the world. We've talked about cruise ships and other types of vessels. We've talked about any long-term care facilities. And the reason why we've spoken and we've been so concerned about these facilities for two reasons. One is that if a disease gets into a closed community, the disease can spread very quickly. In fact, one of the most successful programs for doing sentinel surveillance for influenza over the last 30 or 40 years was using boarding schools to check for the disease, because once influenza arrived in a boarding school, it spread like wildfire. So you could pick up a signal of the arrival of influenza in a country by these groupings of people who amplified the disease. They almost became like amplifiers. So anywhere where people come together, a respiratory illness will spread quickly. That's always a difficulty and a problem. If it's a young, healthy community that are infected, then obviously the impact on them may be less, but at the same time could be significant. When that disease gets into an institution or a facility in which there are many vulnerable people, be it people with underlying conditions, older populations, then the impact of the disease, not just the transmission, is great. And I've said this before at these press sessions. It doesn't matter if you're in prison, it doesn't matter what your crime is. All citizens and all people in society deserve to be protected under the law, and as such there are responsibilities for all those who manage facilities to, number one, try and shield those facilities from disease getting in, having the necessary measures in place to reduce the chance that disease will spread, and that means having the capacity to detect very quickly. And I think one of the things in an institution that needs to be done really, really quickly is the first signal, the very first signal that something is wrong. You need to react very quickly. You need to be able to remove any individual that's suspected of being a case very quickly from that grouping, and you need to test, because a spark in a situation like that turns into a fire very, very quickly. Now, implementing those types of measures, hygiene measures, surveillance measures, and physical distancing measures, is a very constrained. It's a very constrained issue because prisons have a limited size. Some countries have dealt with that by releasing prisoners for non-violent crimes or prisoners towards the end of their sentences. That can be done. Authorities in Singapore are working very hard to improve hygiene and physical distancing in the migrant dormitories there. It's much more complex in certain other situations. People very often in mental health institutions have significant other needs, and they need to have that care and support. So you can't just leave people without that support. I think not only are there significant mental health implications of the pandemic itself on individuals, but there are people who have significant mental health problems who need constant support, and it's a very complex issue. How do you reduce the chances of infection in these facilities while still being able to deliver adequate care? But it also speaks, I think, in the long run to the whole concept of large-scale institutionalization of people with mental health difficulties. I think we need to find more sustainable solutions for dealing with those in our society who suffer mental health illness, and large mental health institutions in which people are sometimes abandoned is not necessarily, not only from an epidemic point of view, not a good societal solution for dealing with those in our society who are unfortunate enough to deal with long-term mental health issues.